I hope the patients understand that I'm not just there to do a hip or knee replacement for them, but that I'm there to help them decide what the right surgery and the right pathway, or maybe even non-operative care, is right for them at the time for them and their family. And when we do decide to do a surgery, that I'm there not just to do the surgery, but to help them set attainable goals post-operatively and achieve those goals and really help them through the recovery process. I love the patients, love the surgeries, feel like I fit in with those around me. And then also, I just love seeing people being able to get back to what it is that they want to do. So I ask every patient at the start of, our care or our journey together, what do you want to do that you're not doing, that your hip or knee is keeping you from doing? Is it gardening? Is it caring for your grandchildren? Hiking, biking, swimming, or just walking around the house without pain? And it's really extraordinary to see them come back a few months later and be able to do those things that they'd been so limited to for a while. So I actually started undergrad with an interest in medical research. And after doing medical research for a while, I realized I needed a more concrete and direct impact on patients to be satisfied with what I was doing. So that's when I considered medicine. I started volunteering in a surgical waiting room and was at the other end of what patients were receiving, and realized that it would be fantastic to be the surgeon at the other end that was really helping that patient and that family through a very stressful scenario. So I grew up in a small town called Bethalto, Illinois, on the Illinois side of the river with about 9,500 people. My family's still over there. I have 3 older sisters and 8 nieces and nephews in the area. My fiance's here, who's a general surgeon, and I could not be more than happy to return to St. Louis after leaving Chicago for a year. Being back in St. Louis is like a breath of fresh air. I think the culture here at Barnes-Jewish and WashU is a big part of why I chose to return. It promotes collaboration, new ideas, which really allows us to use the most up-to-date knowledge and evidence to make the best decision we can regarding your care. So my plan would be to help continue this excellent department and hospital that we have here by providing excellent clinical and surgical care to our patients. I plan to actively engage in research to help further the orthopedic field, and specifically in hip and knee replacement, to help provide better clinical outcomes for our patients. As a third goal, I do plan to help train the future of orthopedics and try to serve as a mentor to residents and trainees in the way that many of my prior WashU faculty have served as to me and inspired me to be the surgeon that I am.